Good morning. I'm Dr. William Julien. I want to tell you about a procedure we're doing this morning called uterine artery embolization, which is where we put a little catheter through the bloodstream into the arteries or the vessels that supply the uterus to cut off the blood supply so that the fibroid tumors that this lady has will die. And it's something to do non-surgically instead of a hysterectomy or a myomectomy where women are cut open to get the fibroids out. So in this case, you'll see that here's an MRI, which is an imaging study that allows us to see inside the body. Here's the spine. This is a sideways view of the lady. And this large area is the uterus. And it's pushing on different things because there's big fibroid tumors, these dark areas, these round, dark balls. And so what we're going to do is to put a catheter through the wrist all the way down into the uterine artery, which the arteries that supply the uterus, and that way will starve the fibroid tumors and kill them. And 90% of the time, we should have a good result. So I'll let you know how that goes after our procedure and give you a little follow-up. This is a little sheath, a little tube that we're going to work through that is in the radial artery of her arm here. We're going to put our catheter, nice long catheter. It's going to reach from the wrist down to the pelvis. Okay, advance. From the arm, we're headed down into the pelvis. Okay, so this is my big catheter with a little tiny thread-like catheter through it, and I had some x-ray dye right here. I'm going to take a picture of the left uterine artery on the screen there. That little dot you see is my catheter. And now this is the x-ray dye. That's the left uterine artery. So we're going to plug it up with little tiny particles. This is a syringe filled with little tiny particles. If you could magnify it enough, you see there's little tiny spheres, lots of them. So this will be injected. Cool, okay. Let's see here. So, okay, on the left. Okay, so you'll see the tip of the catheter, the little x-ray dye, and that's me injecting particles. The particles are mixed with x-ray dye. So that allows me to see how they're flowing. And I'm going to keep injecting 1 cc amounts until the flow stops. Okay. Okay, see, it's already flowing. It's flowing slower. It's already flowing slower when I inject than it was just a few moments ago. So I'm going to slow my injection down. Okay, we'll do one more 6 and then we'll go bigger.
Okay. You do one more 6 and then we'll go bigger.
Okay, so we're all done. It went great. For review, we threaded a little tiny catheter through the left wrist artery down into the pelvis and plugged up first the left and then the right uterine arteries with little tiny particles, starving the fibroids of their flow. She will now go to recovery with a little tiny compression band on her wrist. After about 4 hours, she'll go home where she'll finish recovering, and we'll be back to work in 1 week and should be symptom-free.